In the kitchen, dinner time. I don't feel or think I'm well. Nowadays it feels like I have a bigger appetite and I always feel like my muscles aren't as good as they used to be. They feel weak.
I've been noticing that too. Also, you tend to have frequent infections. I assume it's because your wounds take forever to heal. I'm not sure why though. Let's go to the doctor next thing in the morning, okay?
They are at the doctor's office.
Well, what seems to be the problem, dear?
Well, I've been having a bigger appetite and my muscles feel so weak for some reason and my wounds tend to take a long time to heal.
And she gets a lot of infections. It tends to be a hassle sometimes.
Let's take a blood test then. According to the blood test, your blood glucose concentration levels are quite high, but your body can produce insulin. It just doesn't know how to respond to it. Sadly, this means you have type 2 diabetes.
Oh my goodness, this isn't a good sign.
Is it fixable?
Sadly, no. You see, normally, insulin is what lowers your blood glucose concentration, since your pancreas beta cells would detect them, causing it to release insulin, where your muscle and liver cells would then take glucose and turn it into glycogen, and then store it for later, which returns you to normal levels. But your body specifically isn't sure what to do with it.
Let's take a closer look at how type 2 diabetes works. After you eat a meal, any carbohydrates you've eaten are broken down into glucose and passed into the bloodstream. The pancreas detects this rise in blood glucose and starts to secrete insulin. The insulin is released from beta cells in your pancreas in response to these rising glucose levels. The problem in people with diabetes is that either they don't produce enough insulin or the insulin they do produce doesn't work properly because their cells cannot respond properly to the insulin. The net result is that glucose isn't cleared from their bloodstream and they have high blood glucose levels which their body tries to clear by various compensatory methods such as increased urination. Why don't we zoom in on how exactly the insulin is produced from your pancreas and what happens to it after it's produced? Let's take a closer look at the flow of insulin inside your body. So, insulin is formed inside pancreatic islets. There are groups of cells in your pancreas that contain several types of cells, including beta cells that make the hormone insulin. What happens is, insulin works by improving the uptake of glucose from the blood across cell membranes and into the cells of the body, hence taking glucose out of the bloodstream. Once in the cells, the glucose is used as energy to fuel the cells doing their different jobs or is stored in the liver or muscle cells as glycogen. After the pancreatic beta cells produce insulin, the insulin flows through the pancreatic vein into the liver. In the liver, the insulin helps promote the transport of glucose from the blood into hepatocytes, where it's further converted to glycogen, fatty acids, and triglycerides. After that happens, it goes through the hepatic vein and into the rest of the bloodstream, flowing into different organs.
Well, what can I do then, Dr. Kim?
We'll have some regular glucose level checkups. But in order to help yourself with this, make sure to keep a good managed diet with exercise. If needed, you will need to have insulin therapy. But let's not worry about that, okay?
Thanks so much, Doc. I'm glad I checked this out before it's too late.
It's no problem, Jenny. It's best to talk to your doctor when you are unsure if your symptoms are serious or not. Have a good day.